Should I?
Got it. Okay.
Yeah.
Yes.
Probably there.
Oh.
Not quite.
I thought that was one.
It was similar. Yeah, we used
Yeah.
for that, but it started just Wednesday. Probably the first thing for down. So now it's expanded. And I get to go tomorrow.
Yeah, we connect with
So I left Atlanta in October of 2017. And 2 years, about 4 months. I heard it's 3 years.
I actually have a personal friend.
Like low on and I didn't have to
I ended over it. So I didn't have to.
Atlanta's always
It's still there
it's 70, but outside of here.
Oh,
It's overwhelming. Somebody get down.
another note, somebody was doing, when I was in, I lived
Family.
yeah. When they first came up, they used
I live in Atlanta.
yeah. Yeah, that is
Chicago. I just moved back there. Only half.
yeah. Okay, so it's, okay, that's what I was doing. I said,
I can make a joke here.
no, then you can escape. I know how it is.
You go back to those houses.
Of course, yeah, really.
Okay, so. We're in college.
You get a lot.
So I have four.
Actually, no, this year I can first
I'll be working. Two of them are.
Right. And minimal. Yeah. And then there's so much.
So you're 18.
That have that.
Okay.
other layers. Comes in and like, whatever, I like it. Yeah, well, yeah, that's hard.
I think that might have been.
Layout. I know where I was at.
They haven't closed any down. The land's shut down. East Coast. Go look at you. That's exactly. Already shut down. Really good. Very like-minded.
A lot of those movies that volunteers. Hi, I'm Rachel. That's a group that's like on a line.
I heard that
My background.
That has been part of the reason for a fairly short
Right. You got it right. So.
I love you for that. That's why
Phoenix, a lot of these things that is more
there's a lot of Chicago now. I should.
Anyway.
Right.
Kevin, you forgot.
We're gonna get started. Take your seat. Yeah. I think of that. I just feel financial. Yeah, Amazon. I probably go back
I looked at that and I thought, I don't think anyone.
I don't think so.
I know.
Hi, everyone. Thank you very much for being here. I certainly wish I could join you in person. When we originally scheduled this meeting, I was supposed to be in Atlanta, and then my job took me on the road this week. So I want to thank the team who has stepped in on behalf of Coca-Cola. I also want to thank Tom and Stephen from the Community Health Charities Board, who were the ones who originally reached out and asked us to host, and we were honored to do that. I'm also honored to serve with them on the Community Health Charities Board. So I understand that I will be missing a great panel that's going to cover the future of work. And as we all know, the future of work is changing. And with this changing business environment, new teams and structures are emerging. There is a growing preference for flexibility. Who doesn't love flexibility? As well as an increase in artificial intelligence or AI. I know that scares some people. It's going to be okay. And robotics, they're creating a new level of human and machine collaboration. Think about all the medical inventions that have been created because of that. And I'm sure that all of these great ideas will be discussed here today. I hope there's a little bit of controversy in the panel, so I look forward to hearing about it. It's also important, though, while we recognize that environments are changing, we have to focus on the health of our communities. Our communities need to thrive for businesses to thrive. And for us at Coca-Cola, this is about doing business the right way and ensuring our future as well, and the future of our communities. This is why I'm proud to work for a company like Coke that actually allows us to do this kind of work. And I'm sure you're going to hear more today from our great speakers who will come in today, and they'll talk about the community programs. Once again, I am so sorry to Tom, to Steve, and to everyone on the board to miss these discussions. I wish I were there. I look forward to connecting with Stephen and Tom afterwards on anything that I missed, and have a great meeting.
Hello, everyone. Good morning and welcome to the Coca-Cola Company. I'm Arthi Arora and I lead our scientific and regulatory affairs function here in North America. And as Bea mentioned in her video, she's really disappointed that she couldn't be here today and wanted us to emphasize how much she enjoys working with community health charities. So on Bea's behalf, my colleague Alba Balin, who's here, she and I are very happy to host the breakfast today. So let me introduce Alba also. Alba is the Vice President of our Community and Stakeholder Relations for Coca-Cola North America. And in her role, Alba oversees our community engagement, community giving, stakeholder relations, our disaster relief, employee volunteering, and also our 5x20 Women's Initiative. So Alba and I are very excited to welcome both the CHC guests here today and the leaders from our local communities. And for us here at Coca-Cola, ensuring that we're building strong and healthy communities is very important. And we're doing this not just because we believe that it's right, but also because we're doing this to ensure that we're investing in our future employees and our consumers. So as we keep the theme of healthy communities in mind, I just wanted to touch on a couple of topics today. The first is our foundation. So here at the Coca-Cola Company, our Coca-Cola Foundation has given back more than $1 billion since its start in 1984 to local communities around the world to ensure their sustainability. And in our hometown here in Atlanta, the foundation has invested, since its start, $174 million in the Atlanta community, including $10.4 million in 2018 alone. So we work with over 400 organizations across Metro Atlanta and really believe in the power of us working together in partnerships, public-private partnerships coming together to invest in our community. The second topic I wanted to highlight is actually very near and dear to me as a food scientist and nutritionist and as a mom to a 9-year-old daughter who's growing fast. And that is our evolving portfolio of beverages as we think about health and well-being. So we at the company are really listening to our consumers, as needs are changing, tastes are changing in terms of what do they want, and we're evolving our portfolio accordingly. So what does that mean for us? So for us, that means we're rethinking both our drinks and the recipes and the packages that we offer them in to make sure that we're reducing the calories and the sugar in our drinks. Because we agree and we understand that while sugar in moderation is fine for everyone, too much of it is not good for anyone. So, how do we reduce the sugar in our beverages? We're also making our choice of low and no sugar drinks available more widely, more accessible, to make it easier for people to make the healthier choice, right? To make it easier to choose what may be right for them. We're also expanding our portfolio. So hopefully you've seen some of our new innovations in the market. We've got new sparkling waters, Topo Chico, which I love, Smart Water Sparkling, our coconut waters. We've got a lot more coffees in the marketplace, organic teas. And so, there's something for everyone. Another thing that we're also very proud of is the fact that, and I'll grab one of our packages here, that we're providing clear calorie information on the front of our packages, again, to kind of take the guesswork out, to make it easy for people to understand what the calorie needs are, and then they choose what's right for them. And most importantly, we're making sure globally that we're really adhering to our policy of not marketing to children under 12 anywhere in the world. So essentially, again, at the heart of our business strategy, we're making sure we're listening to our consumers and giving them the drinks that they know and love. So again, on Alba and my behalf, welcome to the Coca-Cola Company. We're looking forward to the panel discussion today. And next, I'll hand it over to Candace. So thank you.
Thank you.
Good morning, everyone.
Good morning.
My name is Candace Dixon, and I am the Director of Corporate Partnership Development with Community Health Charities. I'm so excited to see everyone in the room this morning, and would like to first thank both Artie and Alba for hosting us this morning, and send a special thanks to B. Perez, who was responsible for having us here today. We have an exciting program for you today, but before we jump into our program, I would first like to tell you a little bit about Community Health Charities. Community Health Charities' mission is to empower people to take action to improve their health and well-being. We've been doing this for more than 60 years through workplace giving, volunteerism, and raising awareness and financial resources by sharing health resources as well. Improving employee and community health is at the core of what we do, and increasingly that means tackling factors that impact health, and we're going to talk a little bit about that today. So, with no further ado, I am going to introduce our keynote. Karen Minyard has led the Georgia Health Policy Center since 2001 and is a research professor with the Department of Public Management and Policy at the Andrew Young School of Policy Studies. Some of her research includes finance and evaluation of health-related social policy programs and strategic alignment of public and private health policy through collective impact. Karen works with local collaboratives and serves on the boards of the Academy Health, National Network of Public Health Institutes, and Archie, the Atlanta Regional Collaborative for Health Improvement. Karen has joined us today to discuss the Atlanta Transformation Model and the impact that it has on reducing employer costs, increasing employee productivity, and what is predicted would attract businesses to this area. So everyone, I would love to introduce Karen Minyard.
Thank you so much. I'm really happy to be here, and I understand that there are a mix of people who are in Atlanta now, people who have been in Atlanta, and people who are from other places. And I want to take a little bit of time this morning to tell you about some work that's been done in Atlanta and how it might apply nationally as it relates to building a culture of health. Whoa, that was delayed. So in 2011, a group of people, a dozen, came together in Atlanta and were feeling concerned about how things were in Atlanta. One of the people who was early involved in that was Linda Blount, one of your board members. And we had this idea that we looked at what was happening in Atlanta, and there were a lot of organizations doing community assessments. The public health, the hospitals, the federally qualified community health centers, the county governments. We counted 50 assessments that were going to be done in Atlanta that year. And we thought, well, why couldn't we do one big community assessment, then maybe plan together what we could do with that assessment, and then actually invest together toward a future that we all would desire. And we thought, well, we'll just get the hospitals to each pay for the assessment because they have to do it anyway. And Linda and I and our colleague Catherine Lawler went around to a lot of hospital partners, and mostly they said, we don't want to be first. And so our group, our 12-member group, said, don't stop, go ahead, do the community assessment, and let's see what happens. So we went through a process of doing a community assessment that everyone could kind of plug into and could use the data, use the information, use the needs, and that we might be able to assemble the resources to actually target some of the things that were problematic. So now I didn't even touch it that time.
I'm gonna do it.
Oh, okay. There's some little buttons right here too. So one of the things, in fact, somebody already, I think it was you that mentioned already, we looked at this information that was done in Virginia at the university that looked across multiple cities in the US and looked at life expectancy in various different zip codes. Now, if you look at a map of your city, you're going to see the same thing, that there are within several miles, and you can see here, Buckhead in Atlanta, if you're born in Buckhead, your life expectancy is 84. If you're born in the area where the Samaritan Clinic is, then your life expectancy is probably 71 or 72 years. And so we're saying, this is not the way we want things to be. And if you look, so just look at this kind of red belt. Now let's look at the next slide that shows this is a ranking of cities, the 500, CDC's 500 cities data. And the pinker, the worse the health rank. So you can see that the life years of expectancy and the health is very different in different parts of Atlanta. And when they first came out with those rankings about life expectancy, it was a national release of the data, and some national news folks called me and asked me to say something about those rankings and I said, well, over the years, I've looked at probably 100 different maps of Atlanta. I've looked at obesity, heart disease, poverty, third grade reading level, high school graduation, any map you can think of, and they all look the same, and they all look the same as the life expectancy. So I could have picked from one of any number of maps. Lately, the Atlanta Regional Collaborative that I'm going to be talking about has been studying a lot about equity and about our history of racism. And one of the maps that we've looked at a lot has been around the redlining for housing. And you take that map and put it on top, it's exactly the same. And so this is really something that we said, the 12 of us who got started in the beginning, we want a different future. It's not just that we want to assess, plan, and put our money together. We actually want a different future. We want a different outcome. So in the next slide, I'll say just a little bit about what happened then. So we had the fortune of being able to use a computerized model called the Rethink Health model to test about what kind of strategies could we put together that would actually make a difference. And we were in a room with about 70 people. We were seated at tables. Each table had the opportunity to choose from various kinds of interventions that might change our future. And then we were able to run the model and test those interventions and see what difference they made. And we were looking out to the year 2040. If we did these things in this way, where would we be in 2040? And some of the groups came up with things that are very close to the healthcare setting, like access to doctors and some things about care. Those, while helpful, did not solve the problem, because what we know is that when you think about health and what contributes to health, that 80% of what contributes to health happens outside of the hospital. And so all the things that relate to behaviors, environment, genetics, social kinds of situations are much more influential on overall health. So one of the scenarios that we had these components. It had family pathways. And family pathways is something that is thinking beyond health, really, and thinking about what are the pathways for children to graduate from high school and actually have entry into college or technical school. How do you have the kind of transportation, housing, and food that you need? It's a basic social stability kind of a thing for families. Then there was care coordination, which is how do you get things coordinated in the system so that you aren't having a lot of duplication. And then another part was healthy lifestyles, and this focused on fitness and obesity issues and other kinds of at-risk sort of behaviors. And then there is the basic access to insurance. Now, in Georgia, we're a state that hasn't yet expanded Medicaid. And so we have, in some cases, for people who have lower incomes, limited access to insurance compared to some of you who are from states who have actually expanded Medicaid. And there's a lot of economic impact around all of that. Then there are the things that are related to, okay, if you're going to do these things, how do you actually pay for it? And one thing that you need is some money to get started, an innovation fund that gets you started. But then there's some things that you are able to make savings in the system that could be reinvested in the programs. And so a big part of what we're always thinking about is if we do something over time, how might we save in a way that allows us to feel more comfortable in reinvesting? And when the model was first built, they thought about saving in healthcare costs. But as we've expanded this, we've thought about other kinds of savings that accrue to the system. And how might we think about that? And I've been involved with the Robert Wood Johnson Foundation over the last 4 years in a project that's focused on innovations in financing. How do you see the money in the system? How do you reorganize the money in the system? And how do you put the money toward population health goals? And 7 sites across the United States, they weren't fully independent because they learned from each other along the way, but pretty much independently came up with the concept of creating a pooled community fund. Some of them call it a wellness fund, a well-being fund, a wellness trust, but putting their resources together and thinking about how they might have investment in population health, which is all in the same category of this work. And in those communities, they have unlikely partners. In one community, they invited business partners into their traditional health collaborative. And it turns out that the president of the community bank was really on fire about his community being healthier. And so he worked with them to create this stratified investment using some of the banking resources that might have to be in the form of loans or low interest loans, using some of the hospital community benefit and other philanthropic money that might be able to be paid back with service or given out in grants, but to have a whole portfolio. And so they had an interesting source of funding, an upstream or thinking about how things happen in the social determinants of health, use of the money, and then they had to figure out what their structure was. Now, sometimes you could have a very simple structure for something like that, but sometimes because they had the banking money, they had to have a more complex structure. Another community was really focused on how do we help the small businesses in our community improve health, because most of them are too small to have wellness programs or even maybe health insurance. And so they created their well-being trust to focus on support for all of their local small businesses. And they brought in the chamber as their key partner, and the chamber is where they're housing their work. So this way of putting together resources, whether it's just a grant or this other kind of portfolio of resource, is a way of thinking about how you might make some of these things that make a difference happen. So the next slide has some, so in this we're talking about how do we build the better outcomes, and you can just kind of click through there. We're going to show that there's the pathways, expanding insurance, care coordination, the healthy lifestyles, these funding initiatives, and all of that comes together. We're getting it now. Click it again. You didn't know it's going to be complicated. Click it again to some outcomes. And so if you dig into this model and you look at if we actually implemented these things, if we looked forward and we brought partners together and we did the things, what would happen? We'd have a 7% increase in worker productivity, a 16% increase in access to preventive care and chronic care. We'd have 45% less non-urgent emergency room visits. We'd have 13% less in healthcare costs. We, at the time, realized that we were spending $11 billion in Atlanta on healthcare, and we didn't think we were getting what we needed for that money. And then you'd have 13% less in hospital readmissions. Archie started with those 12 folks. We started with creating this vision for the future. And now Archie has over 100 partners who have come together. And this is where I will issue a repeated invitation to anyone here. Is anybody already in Archie or has been to one of the Archie? Yes. So several of you have been a part of Archie. Archie has quarterly breakfast where we bring all the partners together and think about how do we move this forward. But a lot of people say to me, I want to be a part of Archie because I like the long-term vision. I like the idea that we're not just doing something here or something there or something around the edges, but that we're really trying to look at what is at the heart of our community being different and those maps being different in 2040. And so the next slide, how do we do that? So we create this environment, we incentivize partners, maybe unlikely partners, to be a part of what we do. We look nationally at innovative models and bring that information to Atlanta, and we create an environment of mutual benefit. So it isn't just about what can you do for Archie, it's about what could Archie do for you to help you be better in what you're making happen. And the proof will be when these outcomes happen. So we co-design solutions, we transform systems, we build credibility, we carry the torch. Part of my effort today is carrying the torch. And then we think about how can we create a different kind of financial structure in the system where there could be investments in our future. I've really been inspired in all of this work by Eleanor Ostrom. And Eleanor Ostrom debunked the tragedy of the commons, which says that if there is ever a common resource, either you have to put it in the government to manage it, or you have to break it up and put it in the market. That people cannot work together to manage a common resource. And in this case, for us today, we're not probably talking too much about grazing lands or fisheries. We're talking about the common resource being the health of our communities. You could even say, if you want to narrow it, the health of an employee group. But it's taking responsibility for a common resource, which we're saying is health. And she looked all over the world and saw hundreds of examples of people being able to come together and have a shared responsibility and to make a difference, to hold each other accountable. And she had 7, I was going to show you her principles, 8 actually, that she noticed when she looked at all of these, that the boundaries were defined, that the rules were adapted to local conditions. So you wouldn't really be able to make national rules and apply them strictly in every location. Each location would have to have some say about the rules, that there would be collective decision-making, monitoring by those involved. I like this one, graduated sanctions for rule violators. I think that's a hard one. So I'll give you an example. In the fisheries, they had an agreement that they wouldn't put out their baskets to catch the fish at certain times. And everybody agreed. And if you put your crate out in one of the times that you weren't allowed, then the first day you would come back and there would be a little pink ribbon on your line. And that's to say, we noticed that you were doing what you weren't supposed to do. If you did it again, the next time you'd come back and your crate would be smashed. It would be destroyed. And the third time you would come back and your boat would be sunk. Now, this wasn't something that came from above. This was something that everybody agreed to. And so this was kind of an extreme case, but they held each other accountable in that case for protecting their fishery. Cheap and accessible conflict resolution, power recognized by higher levels of authorities. That means that if you're not the CEO, but you're involved in the collaborative, that your CEO or the executive management knows what you're doing, agrees with what you're doing, sanctions what you're doing, and that the organizations are in nested layers. It might not be exactly the same people or the same participate in each one. So in thinking about setting these up, these are some valuable strategies to think about. I also wanted to introduce, I don't know if you have talked in this group or thought about the concept of anchor institutions. Is this something that it's something that is very prominent conversations in the education environment and the hospital environment, but it applies to any organization. And you're performing like an anchor organization. Like we just heard a little story about Coca-Cola and Coca-Cola's investment in communities. Those are some of the characteristics of an anchor organization, and it can go even further. So if you think about how, I want to say just a little bit more about that, how this having this transformative effect on the lives of people in the community, and you could just even break it down to purchasing, thinking about where do you buy, who do you buy from, how much are you able to buy that supports the local economy, all these areas around purchasing, hiring, who do you hire, how do you hire, how do you handle diversity, how do you hire local, and then investments. And that is, where do you put your money that you have to invest? Both your money you're investing for return, because in some of these collaboratives, if people are putting their corporate investment that they expect some return, modest return, into the community and getting some return back. And I can tell you a lot of stories about how that's happening if you want to know more about that. So one of the things that I wanted to share with you was I went into the Rethink Health model, and I looked at the detail of the assumptions and what was the money attached to the assumptions that had to do with the kinds of things that a business might be interested in. I mean, I know that you're interested in health and well-being, but I'm talking about show me the money. Like, where is it that there might be some opportunity for money? And there are two big ways that creating this future of health impacts the economy of the business. One is that it decreases the annual per capita healthcare cost per employee or in the workforce. And so if you were to create this environment and make these investments in overall social determinants of health and health in the region, then in about 5 years, you could think in let's just say in the Atlanta region of a decrease in healthcare cost of $350 per employee. That's in Atlanta, something around $300 million. If you look out to 2040 and you implement these things, if you're disciplined about the implementation, you could look at $1,000 decrease in annual per capita healthcare costs, $1,000 per employee, which in Atlanta would be somewhere around $1 billion. So there's an opportunity. Now the business could say, wow, we've saved this money, and you decide what you want to do with that saved money, or you could say, we've saved this money and there's a certain portion of it that we're going to reinvest in the community to keep this wheel spinning and to keep this good thing going. The other part of this work is that when you create a healthier environment, you change the workforce. You change the workforce in how many people are really able to work, who have a health and a stability in their lives that would allow them to work. So that would be the population of work. And you also make big improvements in absenteeism and presenteeism at work. And if you go into the model and look at the numbers, by 2040, if we were able to do this, we would save $60 billion because people are better able to work, and we would have less absenteeism and a stronger presenteeism in the workforce. So not only is there a good reason to do this that is related to we all need to do good, there's a business reason to invest in this way. But it's not just doing some small one-off. It's really more about having this broad vision and thinking about where do we want to be and how are we going to go shoulder to shoulder to invest in making that future happen. So, so I would recommend 4 steps for you. One would be explore the related data in your world. You have maps and opportunities to look at the geographies that you have responsibility for, to see where the situations are challenging. You could look at them, if you want to look at some social determinants of health equity, you could look at some of them, cut the data by geography, cut the data by race or other ethnic groups, and you can begin to see the pattern of where the investments are needed. If you're in Atlanta, every single person in this room is in Atlanta. I want to see at the next Archie breakfast. And if you are in another place, there may be a similar collaborative. Many cities and regions have developed collaboratives that are focused on how do we transform health in our region. So join a group, and then share in the vision for a culture of health. Just think about that long term. Here's the future we want together, and then identify a specific action that you could take to be a part of that future. So that's the overall story.
Well, let's give Karen another round of applause. Karen, thank you so much for that bold vision of the future for health in Atlanta. We're really excited to be able to start this conversation today to talk more about what health equity looks like in our community. And so, as we continue this conversation, I would like to now invite the panelists to the front of the room and introduce our moderator. Linda Blount is the CEO of the Black Women's Health Imperative and Community Health Charities Board Secretary. She is going to moderate and introduce the rest of our distinguished panel. Thank you.
Good morning. Thank you, Candace. How's everybody doing?
Great.
So we now have the vision for what at least Atlanta could look like. Thank you. So I have the opportunity of the pleasure of introducing a panel and welcoming you all to, I think, what will be a pretty interesting, stimulating conversation. And Alex and I were talking, it should be a conversation, so please feel free to jump in, but we'll also leave some questions. We've met Karen. I also want to introduce Dr. Vita Johnson, who's the Marcus Professor in General Academics and Pediatrics and the Director of Partners for Equity in Child and Adolescent Health and the Director of the Georgia School-Based Health Alliance at the Emory School of Medicine. Dr. Johnson. She had all the time. And I'd like to introduce Alex Cunningham, Senior Advisor for Chevron. We can give you a longer title too.
No, it's all right.
So I'm going to sort of start off with some questions, and please be thinking about some questions and thoughts and responses that you may have had to what Karen said, but also kind of what you hear. So I'll start with this. In the past 10 years, certainly longer than that, but in the past 10 years, the demands on the workforce have changed dramatically. Bea mentioned AI, technology. We have distributed workforce. People work all over the place now. We're less likely to be in an office, maybe less likely to see each other. There have been one or two changes in healthcare policy in the last 10 years. And reports our employees are under much more stress now than they've ever been. So, Vita, I want to start with you. And as a disclaimer, I actually sit on the board of the Georgia School-Based Health Alliance.
So she can answer the question.
So, how does the current state of health among youth in both Atlanta and Georgia impact the workforce? And what are you most concerned about?
So there are a lot of challenges, right? When we look at our state, we rank 39th in overall well-being for children. We sort of stay around 39, 40, 42nd in the country. We rank 39th in health, 34th in education, 39th in children living in poverty. And so we have just tremendous challenges in educating and raising children who would be our next The overall picture can be somewhat grim, but we have made some improvements. We've made improvements throughout education. We usually were like in the bottom, but now we're kind of rising to the sort of the middle. Can you hear me? Okay. And our high school graduation rate has increased, which I don't know what to say about that. I think it's increased throughout the entire country. I'm not quite sure is a direct reflection of how well prepared our children are, but clearly the graduation rate has increased, and that has a direct impact on our workforce and on our ability to raise healthy and productive children. I think the greatest challenge for me is just the inequity in all of this. When you look at children of color and you look at the dire circumstances around education, around access to health care, around models, around even the juvenile justice system that really impacts in a negative way our children who will be our next workforce. And so a lot of my effort has been in how do you sort of level the playing ground, the playing field. I think you have to start very early. I think it starts in early childhood education and it goes throughout the childhood experiences and up until high school and even beyond there. But we have to do more in preparing our children starting at the time that they're born to be able to achieve academically, to pull themselves out of the throes of poverty, and so that they can actually achieve and be a valuable workforce. We always talk about children being our future. We just throw that out. You know, children are our future. We wrote a song about it. Everybody's happy. We can probably sing it here together. But children are more than our future. Children are all that we really work for, right? And they're really the legacy that we leave behind. And we really need to invest more in our children, starting when they're very, very young, and then following them throughout, and then really be intentional about those children who are left behind. We haven't done enough of that. A lot of lip service to that. And so we really need to work very hard on making sure that we identify what those issues are and then invest our efforts and our resources into making sure that they have the same opportunities as everyone else.
So a few years ago, Harvard and Berkeley studied where they looked at poverty. And in Atlanta, it turns out that if a child is born in poverty, he or she has a 4% chance of ever leaving poverty. So given the inequity there, talk about what your work means in school-based health, but also kind of what you see happening with the workforce.
After you says, can you hear me?
Yes.
Yeah.
Okay. So the work that we do, I direct Partners for Equity in Child and Adolescent Health, and one of our goals is to increase access to healthcare and to improve the delivery, but also improve the overall being for children. And we do it through four mechanisms. One is to expand school-based health centers, and we'll go on and on about that. The second is to create a family-centered approach to caring for at-risk children. The third has to do with early childhood literacy and school readiness, and the fourth has to do with how we train our pediatric residents so that they can address the social determinants of health. The school-based health centers, our primary goal, I always say, is a means to an end. It is to increase access, is to improve the delivery. It's also to impact the educational outcomes for children. And we have, over the past 10 years, been working to increase the numbers throughout the state of Georgia. We only had 2 for a very, very long time, and now we have 48 since 2013. Our ultimate goal is to improve the educational achievement for children. And we know that children don't succeed if they're not healthy. They don't succeed if they're not socially and emotionally connected to the school. They don't achieve if they're not present, and they can't achieve if they don't have hope. And so those are really the basic functions of the school-based health centers. It's a doctor's office in a school, plus it's an interdisciplinary, multidisciplinary approach to caring for children, because you care for them with not only the clinic staff, but also the teachers and the school nurses and the counselors, and everybody's working together under one roof to address the needs of these children. And so like I said, our ultimate goal, the light will go out, is to, thank you, is to improve the academic success for these children, but also give them skills to be able to pull themselves out of poverty into prosperity so that they can be a very effective workforce for the future.
Thank you. So Alex, you represent a fairly large corporation, global corporation. And obviously you're thinking about this. Karen talked about the Atlanta transformation model. there were clear indicators for investing in health. And B mentioned about something about having a little bit of controversy. So we've been talking about reducing employee health costs for a long time, for years. The Atlanta transformation model is one example of how that can be done. Yet sometimes it's a tough sell to companies. So what's your thinking on why that's the case, but also what are you seeing in employee health and what kinds of trends are you most concerned about?
Yeah, I think that maybe the reason it's happening is that, where it's happened historically, is that there's been so much focus on direct costs, and we haven't done a very good job of really talking about productivity, workforce productivity, and the impact that health can have on getting healthy people in the workforce, makes them more productive, and the impact that has on business. And I think that that's coming around now. I think, I'm hearing a lot of the same conversations that Chris talked about from, Atlanta City internally inside of Chevron. And we are kind of like a country almost. I mean, we're all over the world. We have so many people that it's a very large workforce we have to think about with very different health needs. And, when you really look at the measurement around that, using good data, I think it can help us get to a place where we're heading now, where we're really putting more focus on that. At Chevron, we've had a huge focus on safety. Our safety culture is embedded in the company, has been for many decades, and it's really based on keeping people safe, but it's also around operational safety. We don't want to have loss of payment. We don't have any kind of fires or disasters that impact people or the environment. But it's around the business side, and they haven't really thought about. I mean, there's been a lot of internal work around the health of our workforce, but it hasn't really been front and center like safety has. And safety, it's obviously related, but we have our health, environment, and safety group. Really, the environment and the safety piece has really kind of overshadowed the health piece. They say it's had a small H for many, many years, and we want to make it have a capital H now and have it just be a huge part in creating a culture of health inside of the company. So we're on that journey right now, and I think it's something that is going to see a lot more investment as we move forward.
So in this country, chronic disease is obviously at the top of the list of healthcare concerns. That's growing globally. But as sort of that internal conversation at Chevron, are there some specific areas of health that are becoming of great concern? I understand safety, but as you think about what the next 10, 15 years look like.
Yeah, we had a lot of focus on infectious disease for a very long time in a lot of areas of operation. HIV, tuberculosis, and malaria impacted our communities and our workforce pretty directly. And so for good reason, there's been a huge focus on that. But as we've partnered with Institute for Health Metrics and Evaluation and other organizations who really look at, using data to kind of figure out what are the key issues for our workforce and communities around the world, we realized that the non-communicable diseases are actually impacting us more significantly and are actually a greater cost to the company than infectious disease. And so there's been a huge uptick in looking at heart disease, mental health, cancer. So there's been significant investments starting to go into that from our side.
So reducing employee healthcare costs by $350 per employee would actually make a difference.
Yeah. The struggle that Chevron has is that we have, different healthcare for our employee population in every area where they are. So it's, it's very challenging for us to be able to have consistent, right? And we do. And it's the equity piece for us too. And how do we get people, the same type of healthcare around the world? Right. It's very difficult.
So Karen, from a policy perspective, thinking about Georgia, what changes in policy or new policies do you think are needed to actually really achieve the vision of the Atlanta transformation? And would you talk about how the academic and business might work together to improve community health and workforce health?
Well, let me pick up on something Vita said about where health starts. And I think about health as starting with having women of childbearing age being absolutely as healthy as possible. And I'll take Georgia as an example. I'm trying to see who's in here because I don't want to get in political trouble. So one of my imaginations related to Georgia is that we would take advantage of some of the opportunity for there to be access to insurance, public insurance for people who are low income. And if we did that, one of the things that we could do would be to cover women of childbearing age and have a big campaign about just how do we have, and I don't know what age you want to start. Is it 16? Don't tell me it's 14.
I'm gonna say,
To 40 or 40, but like just a push toward health. Everything that you could do, a campaign of if you're a woman of childbearing age, we want you to be healthy. These women, when they become pregnant, and half of the births in Georgia are women with low income, when they become pregnant, they would be healthier. So we'd have better outcomes. And also, if we were to put them in this kind of opportunity for Medicaid, the state would get paid 90% of their cost of their care and the cost of the care of their baby. If you wait until they get pregnant and they're eligible to be a part of the public insurance, then you only get 65%. So there's a very valuable financial implication. And when these kind of dollars coming into your state from outside are really important economic development dollars. They're dollars that aren't just, they're not only circulating, they're coming from outside, and then they're creating an economic impact. They're creating jobs. And so this is a whole cycle of opportunity. So I think about women having babies with a better, stronger birth endowment, being able to be supported in their first 1,000 days in a way that they hear words, hear affirmation, have an environment that's different, and then they're reading in the 3rd grade, they're doing well in math and science in the 7th grade, and they're graduating ready to face the world, technical college or college, with high school graduation. So there's some policy that makes good business sense. And I come from a background in nursing, and my PhD is in business. So I'm always thinking about the people and caring about the people. But on the other hand, show me the money. So where is the money in the system, and how can the money flow in a different way?
So there's a sort of commonly held belief, or it gets repeated a lot, that if a child is not reading at grade level by 4th grade, he or she has basically an equal chance of graduating high school or going to jail. Some people say even greater chance of going to jail than graduating high school. So businesses, as we think about a tightening job market, they're looking for employees. How can academics and business, and Alex mentioned data, how can these two entities, sectors, work together and use data to actually improve those outcomes, so that we're not talking about kids who can't read at grade level at 4th grade and likely to go to jail?
Well, I was thinking about this when you asked. I'm in the Andrew Young School of Policy Studies, and our big initiative now is policy in the digital world. And we have a very intensive study of all things related to artificial intelligence and availability of data, merging of data, and how that impacts what we need to teach students, what we need to do to support government, and what we need to do in research. And it's not that everything is going to change. There's still the personal touch, but there are a lot of opportunities to make things different. And one of the things I was reading about recently is this, and maybe somebody in here that I met is in pharmaceuticals, but digiceuticals. So these are digital apps, maybe, that replace a pharmaceutical, a medication, but have an impact, and they might have an impact on um, mental health or some kind of thing where you use this, and through the interaction with the technology, it actually changes you in a way that a medication might. So there's a lot of opportunity with that. And I think that universities, the government, the private sector, all thinking about how do we take advantage of these opportunities. I was going to say something else about the issue of the workforce. If you think about, so we have the Generation Z, that is the current new generation that was born after 1996. We have the millennials, which are Generation Y, born 77 to 95. Generation X, 65 to 76, the baby boomers, born 46 to 64, and then the silent generation that was born before 1945. And one of the things that I see happening in the workplace is a bemoaning the new generation. And there's a different way of thinking about what is the power, the opportunity, the talent of each generation, and how can those talents be woven together to create a different future. And I was working with a group of millennials, and they really resent the way us baby boomers think about them as slackers, but they have a way of looking at things and thinking about things that can bring a lot of positive if you can open up to that opportunity. So that's one of the things that I think is important for us to do, is begin to think about what the opportunities are. And one of the things we think about the younger folks is that they have a lot of digital capability, but in some ways they may not be tech savvy, but they're all tech dependent. And so acknowledging that there are people who never knew about a cell phone.
I have more comment on that. So, I mean, I also think that when we're talking about the new generation, I think they expect to be happy at work, right? They want to be happy at work. Right? And I think that's something that in the older generations, they felt like work was something that you had to have to work, right? And I mean, I can understand that, but that, it was around kind of the discovery of the internet and the implementation of that, where people were kind of like, we're all connected in ways, and we have flexibility, and we're like, why can't I go home and pick my kids up from school if I can just telecommute for 2 hours after I've gotten home? I mean, why wouldn't you let me do that? And so there's this kind of, people are calling it a sense of entitlement, but I would say it's a sense of flexibility, a desire for flexibility to support our lives so we can be happy and healthy and take care of ourselves and our family, right? And so it's this kind of sense of, how do we enable that and create these cultures of health that leverage technology to really allow people to working in the way that works for them.
So Vita, a lot of the kids in the schools that have school-based health centers aren't in any way having this conversation. It's not on the horizon. There's great potential, great intelligence, it's all there, but this is not the future that they're envisioning.
Mm-hmm.
So talk about what the business community, public and private sector, how the sectors can work together so that those kids even can be thinking about having that conversation.
Great question. So I always say children need three things to succeed in life. First thing they need is validation. They need to know that they're worth something. That should start in your home, but clearly that can occur at any point in your life. Sometimes in your school you have a coach, or you have a teacher, you have someone, but at some point someone really needs to understand that they have the capacity to achieve something and go towards that. The second thing they need is a vision, right? So vision really comes from exposure. How can you imagine what you're going to be if you've never seen it, or touched it, felt it? And I see this is where business and where our community can do a much better job exposing our children to the opportunities for them. I've been writing a paper for a long time. My paper is titled "Our Disenfranchised Youth for Whom the Minimum is Enough," because they don't know what the maximum is. They've never seen it, touched it. So you need validation, and you need to have a vision. And then the third thing you need to have is an opportunity. And clearly, this is an opportunity for businesses in our community to come together to be really intentional about first exposing our children to the opportunities that are out there, and then also giving them opportunity to achieve that. I always say, if you look at either spectrum of the socioeconomic ladder, really sometimes the poorest children are really aligned with some of the most wealthy children, because oftentimes wealthy children are never validated because there are other people raising them. Sometimes they don't have a vision because their vision is basically, I'm just going to get what my mom and dad has, right? So they never strive for anything. But clearly, they have opportunity. And so we need to see these children equally, across the spectrum. God, when we were born, God gave every baby 80 to 100 billion brains. He didn't discriminate. He leveled the playing, right? So every child who comes into this world has the capacity to change the world. It's just up to us to make sure that those brain cells connect. And that is the environment in which children are raised, exposed to. Whole issue, like I said, around validation is very, very critical. So we know that irrespective of your socioeconomic status, the color of your skin, where in this world you're born, you have the capacity to change the world. And we need to see every child who comes into this world in that light. And then do everything that we can, again, to level the playing field, to validate these little ones, to expose them to as much positive experiences, to the opportunities that are out there for all children, and then to give them the opportunities to achieve it.
Thank you. So on that note, I'm going to open it up to some questions because couldn't have said it any better.
I work for a local adult literacy nonprofit, and a lot of when we talk about how businesses and like how we can connect, trying to make the argument that there is this multi-generational impact, so the children are going home to parents who can't read and have these low literacy levels. So like, where does that come into, the conversation, or how that is impacting our children's health and them not being able to read? And we're just not thinking about their parents, So
Well, here we are. Yeah. Really, that's where the work is really, really, really hard, right? And so you can't take care of a child in a vacuum, right? You can expose them all these wonderful things, even in their school, even out in the community, and they go back into that environment that has a lot of challenges, a lot of negative impact on children. And so one of our goals, like I said, one of our objectives is to create this family-centered approach to caring for children. So one of the things that we do when they come into our clinic, as you saw them, is they fill out a family resource survey that looks at all of their social determinants. We look at their educational level. We look at their housing and food insecurity and domestic violence and depression and substance abuse and all of that. Because we know that if we can't change the environment in which a child is being raised, we really have very, very little opportunity to really truthfully impact their outcome. And so again, that's another area where we need to invest more in. To understand that, their parents, grew up in an environment just detrimental to the environment they grew up in. This vicious cycle. How do we break that? I think you can do a really good job with health. I think you do a really good job when everybody comes together like Archie to try to figure out how to put all those pieces together in order to really impact the environment, but also their exposures.
Yeah, my name is Kevin Clayton, and I represent a pretty significant healthcare system based in Ohio, in Bon Secours Mercy Health. We're across 7 states. We had 1,000 touch points. And as you all have talked about everything from birth kind of to death, if you will, healthcare systems play a major role in the process. And believe it or not, we actually don't want people to be sick. And as we are doing things in communities to try to promote healthy living, I'd like to hear from actually each one of you. What do you see as the role of healthcare systems in kind of the situation that we're referring to this morning? What role do we play?
Alex, you want to start?
Not really.
Healthcare system.
Yeah, it's interesting. So, in some places, we are the healthcare system, right? It's just kind of crazy, in the really remote areas, and then in other places, depend on the healthcare place government, and some of them are great and some of them aren't, So, I mean, healthcare systems are critical to the success, but I think that, I mean, as a global community, I think we need to come together and find a way to approach health that's consistent. I feel like we have so many different ways of approaching it around the world that it's just, but some are working. We're not using those as models to follow. I don't know that the U.S. is exactly
That's not exactly.
right.
No.
So it's like we have a lot of money, but we're not. You know what I mean? So it's like we have to find a way. Like working together on systems. Right? Yeah, I mean, that'd be like companies have a role in that for sure, and we should be advocates for what's working. And I think there's an element of that is your value system, And I think that we have our corporate cultures are actually very inclusive, right? We have very diverse, inclusive behaviors and cultures inside of a lot of our companies, big multinationals, and being able to advocate and influence on the value of that. Sure that our governments actually are held to the same, level that we hold ourselves.
Advice, please.
Loaded question. I think we've done a better job than we have done in the past as far as the health system is one part of a health system, a huge one. I think we have come to really understand the social determinants of health, how it truly impacts the health outcomes for all people, especially low income. And so we've done a fairly decent job in identifying those people who are at greatest risk and then surrounding them with resources in order to allow them to health. An example, we're doing a lot around case management of what we call repeat offenders who are always hospitalized, right? High recidivism for people. It's usually the same 10, 15% of folks who populate our hospitals because when we send them out, we don't consider the fact that they may not have the resources to comply with whatever the treatment regimen is, right? They may not be able to get to the pharmacy to get their meds. They may live alone and not have support. And so a lot of our hospital systems are actually creating these sort of really case management systems of support. Sometimes they're virtual. It's really interesting when I go to some of these conferences to see how they do this work. Some of them actually do it through telehealth. They'll give people monitors and then every week they'll check in on them, show me where you keep your meds, show me where you're sleeping, show me your cupboard to see that you have food to eat and all of that. So I think we've done a much better job. We just need to do more of that. We need to invest more in that sort of approach to really all of our patients, but especially those. So ask around. You're probably doing a great job. Okay. You do better. Right?
I think of those who are in healthcare industry as being on a shaky bridge between the no longer and the not yet. Because things are really changing in the reimbursement world, the focus on outcomes, the way the government is pushing toward payment. And so healthcare systems have to deal with a very complex changing a business model that may or may not have to do with anything outside the hospital, particularly. Some of it. And so I've seen situations nationally where someone who's in leadership in a health system has said, okay, I'm going to work with the community. I'm going to divert some of our resources into this upstream community work. And it became a nationally renowned healthcare executive. And the next year he was fired because the return on investment in the hospital was 3% instead of 4%, maybe not related particularly to that work. So I have an acknowledgement and an understanding that hospitals have a business to run. And part of the reason why I didn't focus in my talk on hospitals as the only anchor institutions is that I don't think that we can look to hospitals to carry the whole brunt of this. Hospitals have to run a business. However, health systems have opportunities to balance how the money is spent in ways that don't detract from having good business. And in fact, putting together population health, community benefit, and the business of the hospital And thinking about how to balance all that is very possible. Trinity is doing a lot of that nationally with their community transformation investments in several sites. We're part of the evaluation of that project. And so I think there's a balance. There's an opportunity for the health system to look at what are the resources we have, how are we investing them, how are we spending them, and is there a way we could divert some of them or redeploy or manage differently in a way that we become a contributor in our geographies, your multiple geographies, in order to make a difference. So it's, to me, it's a balance of keeping yourself in business because that's important to the community, the economy, the jobs, and at the same time being that anchor organization and broadening the thinking about the social determinants of health, which if you keep those people out of the hospital, then your job of keeping yourself in business is harder. Because then all you have are the really sick people, or maybe the ones that have a lower source of payment.
Thank you.
Yes, please, Emily.
We've alluded to this a little bit in the discussion, but I had the opportunity to go on some ride-alongs recently with my leadership program with great EMS and fire department. And I think about 80 to 90% of the calls were mental health related or psychosocial, emotional health related. And it just became like increasingly glaring to me that that is probably the root cause of a lot of health issues. And, there's just still, I think, a stigma around mental health and treatment. I can't even get my own spouse to go get medicine that I know would help him a lot. So is that a barrier still? And then what's being done to mitigate it?
We'll have Bonnie here. So a lot of work is being done in that arena, especially in the state of Georgia, and I think throughout the country. For those of us who've been caring for this population or just caring for people in general, we have recognized that psychosocial issues are the most important aspect of a person's health, right? And when you look at WHO's definition of health, it is this social, emotional, physical well-being of an individual and not just the mere absence of disease. But we've been trained as physicians to deal with pathophysiology. Right. And, my 4 years of residency, my 4 years of medical school, my 4 years of residency, I was the best clinician probably you could ever want to be, along with all of my colleagues, because we exposed to every zebra that came into the hospital, and we had all the technical skills and, wealth of knowledge. But when I started taking care of families, I realized that I was ill prepared because of all the psychosocial issues that really trump just the pathology of disease. But I think we're becoming aware of that now. And a lot of work is being done. A lot of good folks are out there trying to figure out how do you solve this problem. We have a manpower shortage when it comes to behavioral health providers. We have lack of access and I think a somewhat ineffective approach to dealing with behavioral health issues with families and with individuals and families because we tend to separate their behavior from the person. Right? And we always say, the head is connected to the body. Right? That's not look connected. And so you have to look at the whole person. So we really push for the integration of behavioral health in the primary care. That as you're dealing with the whole person, this is just another aspect of the whole person. And it has direct impact on every other, outcome and every other health benefit for that person. So we're working very hard. That's one of the benefits of school-based health centers. We recognized that about 30 years ago. And so the model is to have not only a medical provider, but also a behavioral health provider working in concert with that person, support staff. And all that. I always talk about when I started this work 24 years ago in the schools, not knowing what I was getting myself into. We went into a school that had a lot of pathology. These children were really ill. And I said, that's cool. Pediatrician, I can go where the illness is, and we can take care of these children. I can get out at 2:30. But it took me about 6 months to realize that it wasn't the physical illness. I had children with severe sickle cell. I had a child who had full-blown AIDS. I had children with significant asthma and allergies and product syndrome, you name it, right? But the bulk of these children, even those with the chronic health problems, the psychosocial impact was much greater than any of the physical illness that you would ever try to take care of. And so from that point on, I really sort of recruited as many behavioral health people as I could, and they become an integral part of what we were doing. And not only were they in the school, but they were in the community as a whole. And we were dealing with their families more than we were dealing sometimes with children because they need it. So I agree with you. And I think we all agree that that's critical.
I would say it's absolutely a focus in the corporate world now, for sure, like on parallel from the past. And I would say that the biggest thing that we could do as companies to really address it that we're not doing right now, most work-life services, mental health services are referral-based right now. So I mean, I have a number I can call, and they'll give me, access to a therapist if I want to, and maybe those costs are covered, or to some degree, maybe 100%. But the reality is, it could take me 2 or 3 weeks to get to a therapist about an issue that I'm like in dire need of dealing with. And so I feel like on-site therapy, somebody in our company that's actually trained to like help people deal with it, not just work stress, but like life stress, things that are actually impacting people on a day-to-day basis. That they'd say if it's not about your job, then it's not really, just here's a number, go deal with it, right? But it's like, I mean, sometimes you just need to talk to somebody, then you can get back to work. Productivity is going to go up, right? And we need to do a better job as companies.
May not be about the job, but it impacts.
It is. I mean, yeah, I've gone through some traumas in my life. And believe me, I was not very efficient those months that I was dealing with it, right? And I actually was desperate to call somebody. And it took me, I'm not talking about a theoretical situation. That was real. It took me like 3 weeks to get to a therapist. Crazy.
I wanted to add something. I think one of the things you're talking about is having that available resource is a very preventive way. So you can catch something early and it doesn't get so far down. But over the last year and a half, I've been working with the Irish government, and they have a new law that wants to look at how our mental health and substance use services integrated in their system. And they ask us to do a realist review of the global literature on the integration of mental health and substance use. And I had 2 big takeaways from that work that are, I think, interesting. One was the importance of hope in any kind of substance use or mental health issue. And you mentioned hope for kids. And in many of my pieces of work, it just came up yesterday when we had been helping a community, and they said, you gave us a reason to believe. So this whole idea of bringing hope, giving people a reason to believe, helping people to see a future, it is universal and very important. The other thing is that mental health and substance use issues and the ability to move into recovery are very tied to having social stability. So if you have supportive employment, and that's another thing where there's an opportunity in business to create supportive employment for people who are suffering from a substance use or mental health illness. They don't have to come to the workplace and hide it, but yet they can be supportive. If you have housing appropriate and food, these kind of very basic things, then you are more likely to see a reason to believe and to be motivated to get the kind of support you need to change your life. And you can just think about your own life. What if you want to lose weight or be healthy in some way? If you don't have stability in your work, your food, your housing, how hard it is to even make a little change. And so there's a lot that we can all do together to try to create that hope and that stability that makes it better for people. And you're talking, everybody's saying the same thing.
Yeah. Well, thank you. I just got the high sign that I've got it. Sorry. My boss has told me. So please join me in thanking our panel. And now I'd like to introduce the Chair of the Board of Community Health Charities, Cynthia Rawl.
We're going to be super quick because I know you're on. Got to get to work. I really want to thank the panel, Karen, Vita, Alex, and Linda for moderating. What I wrote down so many nuggets of important information that I think we all think about from time to time in our different roles. And the goal of this breakfast, something we want to continue with you, is to really get minds in the same room, talk about how we can help bring the resources that we have, because we each have different sets of resources, to create that better future, because that's what we're in the business of doing, is creating better health futures. We have several board members in the room this morning. Kevin is one of them, didn't introduce himself as such, but I want to thank my fellow volunteer board members, because Community Health Charities is here to help engage all of us to make a better future for health in the communities where we do business and live. So thank you very much.
So it was just funny, and then I mean, I will. Oh, I'm in the dog house. She just so I had my mother in the house. I got the white alone. But you know, yeah, I leave it like, you love the ball game. You know, like the important content.
Yeah, you know, I kind of feel this.
Thank you. We're all tied together. That's okay. I know. I'll follow up.
Yes, yes, she does.
My office. really want to do that. And I heard about that.
And that's the thing about that. I'm actually. Like happiness is actually. And I'm like, why? And so I've done a lot with
Thank you. I really
years, bring that to years later. More like having a relationship. Why you know, having fun at work, having fun and being happy. Why is that something I thought of as a negative? And I'm like, having a lot of these. If I can play more time, now you can go back.
Thank you so much.
Yeah.
Evolution.
But I think it's she's cool from
And I love these ideas. I appreciate it.
yeah. All right.
There was some key.
I don't ask.
Anyway, it was good.
Card number, like,
Yeah.
so it'd be like, well, that's not how
There
we.
he is.
Who you're representing.
So yeah, and probably a group of like 25-ish is a good size. We can accommodate more. She's Karen, 25. I was trying to tweet everything you were saying and make notes at the same time, and she was flying, so I apologize. Sometimes that means sending a tweet, you know. Yeah.
When we put together this meetings, breakfast, we would routinely.
We hope it's possible.
60 to 80.
I'll follow up, but I.
From that group or?
From just.
Yeah.
You know, but some public sector, some county, community health managers, chief medical officer.
Yeah, that's.
We would.
Yeah, definitely. That we stuff like that all
Party
day.
line. Honestly,
My lead farmer, Amanda Dow, she's great.
I know it's.
I'm like, I get it. You just know.
The direction.
Gotta look at the budget. Yeah.
I know, that's what he was saying. Really early for him.
And I'm kind of like.
Yeah, go ahead.
It's great. I'll be in touch.
So I
know. Yeah, and I mean.
yes, I wrote down, I was like, Archie. Yeah, so I should have mentioned it. Well,
Yes. I was gonna say, where I wanted to go was
Yeah.
because they've got what I saw.
Where I wanted to was like, you know,
But we have everything else.
hospitals are companies, right? What if there's a meeting, you know, if the CEO gets fired.
Literally on my other
that's
note,
money.
like Archie.
I know.
That's something fundamentally
And it
broken.
might be, if you got great time, Karen just learned how to give you a broader overview of what that Atlanta transformation was. It is, I would love to. It was really great.
You can't present case. Trying to.
Oh,
I
yes.
got my master's.
Excellent.
We did all this work.
I'm just making that up. I don't even know if there is a single.
He said.
You don't even know what it is.
And then you're part of the
I
family.
think they are. They're like, no, this place is paying me, I want out. Somewhere else.
It's like, how do you sell these parties? Like, this was basically modified.
Yeah, I know. And it's
They just.
we need to build right company. I think that honestly.
Yeah, Tom was. He was.
Should be able to use it.
Next level as well.
You're looking good. I'll tell you.
Here's gonna change
Every dollar. Yeah.
I'm happy.
Thank you again.
being here.
So I'm not on.
Oh, good, okay.
All right.
Don't know that she'd enjoy going out.
I'm gonna, if you guys have other meetings.
I'm a sidekick. I'm just.
No, I have there's another breakfast with my cousin.
Good to see you. All right. When you're in town.
You know what part of town?
He's picking me up. I think that I hopefully.
I do.
An extra bed.
Yeah, yeah.
Karaoke.
All right.
That's what I'm thinking.
We will be getting.
Whatever.
All right, you guys. Hey, Kevin.
Oh, it's a pleasure. Yes, nice to meet you as well.
You know, hardball there.
I know. I'm like, how did that happen? After we promised and then they. What do you
What are you?
That was not on the list for questions. We saw that.
Good luck with that.
No, no.
All right, take care. You too. Take care, Rick. Nice to meet you. Very nice.
Nothing till one.
Nice to meet you.
So
Nice
you
job
either
moderating. Thank you.
Work
The
about
lights in your
here,
eyes.
here, there's,
Yeah, we-
work before.
There you go. Candace?
I'm gonna head back to the.
Good job.
Thank you.
Nice to meet you.
Oh, that's right.
Thanks
Do you
for
need some
inviting
help
me.
getting out? You know where you're going? You
I
need
think
some.
so. I've been here before.
You've been here before?
Yeah,
You're-
I dropped little breadcrumbs. We have our own room, just like she has her room in our place. She lives across.
A little extra. Oh, share. I think everything's in the wrong trash. It doesn't matter. Sorry. Honestly.
Last
Nice.
night I-
It really doesn't matter at all.
Went to dinner with-
Sort it all out.
and that's the last night she came back.
To get
She already agreed she would-
start to get
she's-
shreds of data to say, oh, that might be working better. There's so many other problems. There is, yeah. You know that, what you've done with your work. And the other thing.
I'm gonna stay here and work. I'll be here if you need anything.
So I might
Grab
stay
my cell
here. Do
phone.
you have a?
Amanda and I grabbed one of those quiet huddle rooms, but there's, I mean, yeah. Yeah.
The hardest thing.
So Tammy, do you know, like along the bars, are there plugs or? Yeah.
See what our circumstances are.
We're free until.
Well, executive hourly lunch and the rest of us, my lunch. And I'm just.
Everybody, all the other people are getting paid.
Other than that, I'm gonna go back to school.
So why not pay them? Right, it is their expertise that is gonna determine.
I don't think I brought the agenda. with
Whatever it is
me. I
you're
think I left
No, no, no,
it
no,
at the
no,
hotel.
no.
I think
Always
it's like 1 to 3 or 6.
So that's why a lot of communities, you know, researchers, we're good. Yeah, you don't need to bother.
That's the
Because
truth,
they're treated in
believe.
such
And
a
then the
disrespectful-
reception's 5. I mean, like, so it keeps going. Once you hit one, you're booked up.
That's fine. And I
You're free
anticipate
now to
all.
fly like a bird, try all the freestyle machines, customize your drinks. I mean,
I didn't call her Dr. Call her Dr. Sorry. Anyway, so she works on PMS clinics in
You've mentioned
schools. Is
you
that
about
what
20 times.
They're
Yeah.
school-based health centers, so obviously it's their kids, so it's
Right.
pediatric.
She didn't tell you. She didn't.
Child and adolescent.
But it's social and behavioral, medical and behavioral.
No.
She said she was part of a big.
No.
So it's something she put together at Emory. So she's got an NIH grant to do this.
That's her dream. So that's why she can't retire. She was saying she should retire and I still.
Yeah,
She's
travel?
trying and was stopping. She's finding someone. That's her vision.
and we tried to create, we actually did create a 501c3, but
And then they're going to. Anyone headed back to the hotel?
Oh, no, no.
You are gonna go?
Like to see you.
that was at Emory was the challenge.
Where do we?
Oh, right.
This thing is-
Yep, we're here all day. They're gonna come clean it up.
Oh, so
We'll grab our lunch.
Whatever room is going.
are you going back?
So there's
I'm gonna stay
a
here.
room and then
Yeah, I don't know
there's-
when board members
Let's
will
go.
come in and
It's
try
up to
to.
you.
You underrated.
Amanda and I
Now
grabbed
that I
them.
know that, then I can do.
But you can't go to these
All right here.
Yeah.
because we go to those.
Right, and I got those.
We
I
said,
think
okay,
Ponzar
fine,
said
and
she's-
raise money.
Alex already left.
So you turn this in when they.
No, just keep it.
Just keep it.
Yep, just keep it and tell them you're coming back, that you're here for 2 days, and you just keep your badge, so you can get in and out. You're so welcome. If you need anything else, let me
I
know.
might have to, no, it stayed on.
Awesome.
Because this is the computer.
Let us know. Happy to help. You're so welcome. If you need anything, just let me know.
Which is have a common good. Or we support a common good. So either government is a free thing. I wonder if I can.
Well, the literature is pretty clear that the best, the way to solve this problem is cash and conditional cash transfers both in this country and outside the country have been 100% effective. They do it in the Bronx with schools to keep kids in schools. They increase high school graduation rates to 98%. But the problem is in the society, we all seem to want to believe everybody can be from East Alger.
Yes, or
and
Howard
so-
Schultz.
So, you know, you pull yourself up by your bootstraps. It's
Right.
hard. So there's just no appetite to give money. But that in fact would actually solve the problem. And I think, I don't know if you just saw the recent economic research. It talked about how poverty was costing the US economy $700 billion.
Long story short. Long story short.
But with a $175 billion investment, just giving poor people the cash, that would be eliminated.
So
that's
in
really
terms
simple.
of a minimum, like living wage, kind of our minimum income, which is generous. I think there are two really provocative ideas. I should say that need to be thoroughly considered. One is
American Express gives us almost $1 million.
and then the other
But you see the point with people.
is really, really.
American
interesting.
Express
I don't think anyone has talked to like what might
The
actually
issue.
work.
Not
And
everybody.
I have that conversation.
It just was.
Which the younger generation that I read
Life changes. You see, like, even young people have sensitivity.
are toward life and almost or most likely the majority saying yes, there's racial.
It's that easy.
I shouldn't be interested. So I think it'll be interesting to see if
I was able to at the top.
certainly presents the start.
That's okay. But one of the things that I
The
said.
candidates are, it'll happen. All my folks are sort of scratching their heads.
I mean, and it may
There's
be-
a serious proposition that's in Vegas right now. About who's gonna be the nominee. Right, as of this moment, is, they're thinking it's gonna be either Biden or Rourke ticket or Biden Sanders.
Some people I want to be essential.
And the thinking is, it'll be Biden Sanders.
Get them off.
Because they're just afraid that Sanders will take it off.
A year or like a year and a half
But I
ago.
don't know. I don't know if Bernie can he too.
But a year and a half ago, that's what I said I wanted. What I want, something like what I think can be Trump, too much racism. So what I think is that's what I want. That's the ticket I want.
So have the two.
Maybe true, but would be only interested in do whatever they.
All the parties.
All of them, just, they'll do whatever.
Haven't they learned
There's all right. But look at great.
But
So what do we do about that? What do we do if both parties are owning Ellsberg?
yes.
Maybe wait
Which
for
one
the
is-
next generation.
I do think that once the boomers are firing, once we're rolling off the planet, that the younger generation on social issues. Part of what's driving this social issues. We're voting because they like, or they like whatever, like conservative stance on gender issues. And I think that once that kind of shifts, sense for doing the right thing.
Okay, great.
53%. They voted for Trump.
I was trying to, I used to. I used to get very angry. Well, I think personally, usually when people on Facebook, you have 50% of you voted. I did. But I'm such a paying attention. But when people say, do something, and then I think white. And I think it got to keep.
But it made perfect sense. I mean, I wasn't surprised.
It made perfect.
I was
Why
surprised.
disrespect?
You had
Because
changed.
had he
Yeah,
not
so I changed it.
won, there was perhaps an existential threat to their life.
With their choices.
Yes.
Their choices.
They
Have
get,
somebody else
they
protect
benefit
them.
from the patriarchy. It would be actually nonsensical to disrupt that.
And it
It makes
invalidates
sense.
their choices in their lives.
So, yeah, I understand.
People might actually.
Well, I don't know, but it's just, their place in the world. It's like, who's gonna do stuff for you? I have this right. So it makes sense. to me. I don't know what'll happen 2 years from now. Right. I mean, of course, who knows what's gonna happen? But there'll be somebody to replace him. So it might be Pence. And Pence might be, he might be more palatable. Right, I think so, because he's a true believer. From my perspective. I don't see. Just so Pence believes he's right. Yeah. He's got God right here. So one of my theories, one of yeah, it's okay. Well, men think women know. Yeah, that's right. That's a big thing. And so it's different. That's what, that's why people, when they talk about Nancy Pelosi, my first, the thing I always say is, right. I love it. She's over there. Right. She's afterwards. I know. It was like, so, okay, you have an exception.
One thing. Actually, that's not true. I had a blouse. I was even gonna wear it, but I didn't like it. So
nothing. I mean, so people point to her as,
but
well, look, you got
it was like a shiny,
right.
like
So
it was like that's what I mean. My blouse was silk and it didn't seem right.
anywhere near.
No, I do.
Oh, and the most discouraging thing about it, I was one through research piece that I read and did some research. And the most discouraging thing.
Are you just gonna hang around here?
Younger generations' attitudes are more gender issues, social justice issues, all that. One place where they're not.
I'm gonna leave and come back.
No,
you don't need me to. Go. I was gonna come back to Jarvis.
Even young men.
Or saying yes or
Under
no.
the majority, maybe 40.
And if you can.
Women are like
know
75%,
where it is,
80%, all the way up.
they'll say like you have to wait, and you're fine, as long as what's the power.
All right, do I not?
Your wife. I mean, it doesn't.
I don't know why I'm gonna ask my son, I'm gonna say, so what would you say? And I think part of it is they like to say, oh, everybody's an individual, and gender's not a support, so they think it's supposed to
I was gonna say, I don't think they see it as a problem.
Yeah.
Because I mean,
all
you
these
look
young
at,
women I know who are cute, and I don't like them.
He's a very dynamic man.
So wait until you bump your head in the ceiling. And then maybe.
well, I think the next generation is true. There is that, say overarching sense of entitlement. But they've had a very
One of
comfortable
those
existence.
big entity wide.
So they don't see this.
And then that kind of became Accenture's.
Unless they get very active, very.
Consulting around getting you.
Most of them, I mean, they are not competing as so much men versus women on entry level.
They paid
You know.
a minimum.
They have to run into a cheap tax.
I think they have to,
know it
yeah.
when they see it.
Or if they see that glass ceiling and then they can't go any further.
The whole time I'm
then
like,
it'll
you were.
matter by the time that happens.
But that's why I want for him
I know,
to
we were just talking
do what
about
he's
that.
doing because he made his money. He retired. And
Well, I think if you look at government, I mean.
And I think part of what are pretty open about it, that they feel
Just,
to have taken his knowledge, taken his connection,
the way you look at it is what squad you're
taken
assigned
over
to,
that you know that Accenture
men or women, they don't even think, he doesn't think the term is just supervisor.
platform to collaborate.
Interesting, more individualistic.
I think so.
Legs. I mean, they are going to sell it to business, but sort of like.
Yeah.
All right, well, I gotta get back to the shopping slides since I got 4.
And so one is focused on
Yesterday.
schools and one is.
Oh, yeah, if I can try to download that
No.
thing from Andre, but then I got another
I
email
can
from
do it
him.
back at the hotel.
Well, he said, don't send this to the executive committee. I already did.
Either become a reseller
Oh,
or charity.
because he's gonna change it, or?
No, I don't know why. It was kind of like,
In like.
well, that's the whole purpose.
Sort of like the word.
Us
Sarah
meeting.
is just sort
Oh,
of
you mean the
like-
document?
Yeah, his agreement.
Oh, I haven't read that
pricing.
yet. Yeah.
Well, it's got some pricing issues. I'm kind of going, ooh,
Oh, yeah, I haven't even mentioned it.
So, but I already sent it to
And
Eric.
all these different stakeholders. That would be a-
Harry will be all over it on the plane.
Yeah, I was just gonna say, thank God, because I looked
All
at
right,
it
let me
last
read
night.
it before he does, so.
All right,
I never.
so you want to talk here?
I know she.
I know you got along, but you
Yeah,
can't.
so like,
No,
well,
definitely
but I was thinking. Fuel tracker was. And so.
We have a little, or like I say, we can go through this.
Just like the business, whatever collaboration. just seems so.
Well, there's some tables out there.
Thank you so much.
Yeah. You want to sit there?
They were customized. Here I am. Here's what I built in like 10 minutes. Yeah, what reception. Oh, did we forget to do the speakers like that? Oh, boy.
What was that? I thought so. I was gonna ask
We
you. I
had
saw
gifts
the
for all the
bags.
speakers. Yeah.
Well, you have to deliver them.
Yeah, would you like some extra gifts? She has her full complement of CHP swag already. So it was super fun. I was really, you know what? I was really, other than the pop socket.